This is Dr. Michael Brisman, neurosurgeon from Long Island. I just wanted to update you about some different procedures and techniques I use. So one of the most important minimally invasive techniques that I use, and I use it a lot, is something called stereotactic radiosurgery. So this is not, there's no actual cutting involved. Stereotactic radiosurgery involves aiming some super focused radiation beams at something within the head to treat something in the head and mostly in the brain. And the feature of these super focused radiation beams is that they're both very conformal to the target of interest, and the fall off of the radiation is very rapid. So within a few millimeters of the area of interest, there's only a very small amount of radiation getting through. So the main machines I'm using, this is something called a gamma knife. So in this, the person lies in this on this table here after we've applied a frame and the person has had appropriate imaging, usually an MRI. And then once we've created a plan, the doors open here and the person's head goes into this area here. Inside, there are these multiple beams that are always on, that are emitting gamma rays from cobalt sources, radioactive cobalt sources, that we can focus right on an area of interest. So that area gets the appropriate dosing that's enough to treat the tumor or the vascular malformation or the trigeminal nerve, in case we're treating trigeminal neuralgia. But the surrounding areas only get one beam and get minimal radiation. This is another machine that I use that's complementary to the gamma knife. This is my other go-to machine. Again, most of the time I'm using gamma knife, but this is something called an Avalis TX system. This is a linear accelerator that emits X-rays. And the reason I would use this machine is if I want to do a treatment over 5 sessions instead of 1. And the reason I would do that is if the tumor is either larger or it's close to the optic nerves, then I might do a treatment over 5 sessions with this machine. The other reason I would use this machine is if I'm treating something in the spine or spinal cord, because the gamma knife is really for single session brain treatments. So that's good for most things. But again, if I want to do a 5-session or hypofractionated radiosurgery treatment for the brain or a treatment in the spine or spinal cord, I will use this machine. Both these machines are outpatient, minimally invasive, very low risk treatments. Patients go home the same day of the treatment. And I think this has been a game changer for treatment of brain problems, including malignant brain tumors, benign brain tumors, brain vascular malformations, and trigeminal neuralgia. Thank you for hearing about these technologies.